Welcome to New Hampshire's Business. I'm Fred Kocher. New Hampshire has one of the highest healthcare costs of any state in the country. And we have the second highest insurance premiums, and we have the third highest deductibles. So when a healthcare provider in New Hampshire does something to get at that cost, we take notice. And here is the outfit that has done that. It is Alice Peck Day Memorial Hospital in Lebanon. They are increasing access and they're lowering costs for businesses and employees in the Upper Valley. Now, they're incorporating, to do this, they're incorporating 4 existing departments: rehabilitation, occupational health, cardiopulmonary services, and sleep health. The goal of this business health and therapies department is a single place where Upper Valley employers and employees can get health care services that reduce the likelihood of workplace injury and ensure that employees return to work ASAP. With me to talk about this unique, innovative approach to healthcare is the President and CEO of Alice Peck Day Health Systems, Susan Mooney. Welcome. Nice to have you here. And the director of this new department of business health and therapies, Joshua Roylance. Nice to have you.
Thank you very much.
Susan, what led you to do this?
We started thinking about this because members of our boards of trustees are local business owners, and they explained to us how difficult it was to control healthcare costs. And so we were looking for an opportunity to partner with them to increase value, decrease cost, expand access, decrease workplace injuries, and essentially partner with them to have a healthier workforce.
How are you going to reduce the cost? In other words, if a business comes in with employees that need your health care, what kind of cost reduction would they be looking at generally?
So I think one of the big costs for employers is workplace injury and the sequelae associated with that, so the things that come after a workplace injury. And what we've found is that by getting ahead of that, by getting upstream, by preventing injuries, you can really impact the bottom line.
So you're going to be doing preventative work with the companies as well, I'm not sure.
Correct. It's sort of a one-stop shop. We're able to go into the companies and identify areas where injuries can take place, being proactive instead of reactive, and allowing us to supply the particular client with decreased injuries that could potentially take place.
Well, you incorporated some interesting services, rehab, occupational health, cardiopulmonary, but sleep health? That got me.
In relation to Department of Transportation, how we do DOT physicals, right, and a lot of lost time can come from potential drivers having sleep apnea. So if people are not able to maintain their focus, that includes decreased time on the road, decreased money.
Are businesses using it, and do they like it?
Correct. Large business, Timken, right down the road, celebrating over 2 million hours without lost work time. So that way,
wow,
we're able to provide on-staff nurses and ergonomic assessments.
Susan, you're reportedly in discussions with Dartmouth-Hitchcock to collaborate, to affiliate with them. And you've been quoted as saying, and this is interesting to me, the healthcare in this country is at a point where smaller hospitals and healthcare providers can't go it alone, but they must be part of a more integrated healthcare system. Just talk about that for a minute.
Yeah, I think that what we're recognizing is that isolating yourself is not in the best interest of patients, and that the reality for us at APD is our patients get care at multiple different places, and what we do badly in healthcare is coordinate that care and not repeat it. So what we want to do is create a sustainable health system that allows us to better coordinate care for the benefit of our patients.
Your hospital is one of 11 excluded from the New Hampshire Health Insurance Exchange Marketplace under the Affordable Care Act. That's where individuals and businesses, as you know, can go to select their health care coverage. How is that impacting the hospital, and do you expect to get back in?
Yeah, good question. We were not included, as you know, last year. And really that had very minimal impact on us because it was the individual market and it was not a robust market. I think what we're seeing this year is that the marketplace is maturing, and we are fully anticipating that our facility will be available in the exchange.
Susan Mooney, President and CEO of Alice Peck Day Health Systems. Thank you.
Thank you.
And Joshua Roylance, Director of the Department of Business Health and Therapies, a unique service for business. Thank you.
Thank you very much.
If you want to see this interview again or miss part of it, you can go to WMUR.com, click on News, and then click on Project Economy.